Can FUE hair transplant lead to infection or poor healing? Have you ever wondered if a follicular unit extraction hair transplant could lead to complications like infection or poor healing? This is an important question for anyone considering this procedure. While it is generally safe, there are some risks to be aware of. Infections can occur after a FUE hair transplant, but they are quite rare when the procedure is done in a sterile environment and proper care is taken afterward. Infections can happen at the donor site, where hair follicles are taken from, or at the recipient site, where they are implanted. The most common type of infection is bacterial, often caused by Staphylococcus or Streptococcus species. This can lead to a condition called bacterial folliculitis, which is characterized by redness, swelling, pain, and sometimes pus. Fungal infections can also occur, though they are less common. Viral infections like herpes simplex may happen if hygiene is not maintained or if the patient is prone to such infections. Thankfully, the chance of infection is low, typically less than 1%, due to strict hygiene protocols and sterile surgical practices. However, poor hygiene after surgery can increase the risk of infection. Touching or picking at the transplanted area or exposing it to unsanitary conditions can lead to complications. If you notice symptoms like redness, swelling, pain, pus, fever, or increased irritation, it is important to seek medical attention. Treatment usually involves antibiotics and, in some cases, draining any abscesses. Now let's talk about healing. After a FUE procedure, small punch wounds are created in both the donor and recipient areas. These usually heal quickly without significant scarring. However, certain factors can hinder healing. For instance, infections, poor blood supply, smoking, and some medical conditions like diabetes can all affect recovery. Following the postoperative care instructions is crucial. This includes avoiding strenuous activities, not picking at scabs, keeping the scalp clean, and attending follow-up visits. Complications like folliculitis or cyst formation can occur but are uncommon. Temporary numbness around the donor and recipient sites is also common and typically resolves in a few weeks. From a plastic surgery perspective, FUE is considered a minimally invasive procedure with a high safety profile when performed by experienced surgeons in accredited clinics. The risk of infection and poor healing can be minimized through rigorous surgical techniques and adherence to aftercare instructions. While complications can happen, they are largely preventable. It is essential to choose a reputable clinic and follow all medical advice to ensure the best outcome. If you are considering a FUE hair transplant, consulting with a healthcare professional can provide personalized guidance and help you understand the risks involved.